I must say, looking at the two classification, probably T-cell neoplasm is a group of disease where the divergences are minimal, I must say. So there are some differences in the nomenclature of some entities, the way, for example, follicular helper T-cell lymphomas are named is follicular helper T-cell lymphoma in the ICC. In the WHO, the prefix nodal is added to stress on the fact those diseases mostly present in lymph nodes. This is to highlight a small difference, but overall there's good concordance in the number and the names of the entities. Maybe one additional kind of significant difference, but that applies to a rare group of disorders. It's the way to approach some proliferations, clonal proliferations of T cells that affect the mucosa of the gastrointestinal tract. These diseases, as I said, are rare. They mostly affect the mucosa, may not always be mass forming. And the approach in the ICC is to call these disorders clonal lymphoproliferations, while the WHO calls them indolent lymphomas. And, you know, this definitely will be points that need to be resolved for the next, in the next months, or hopefully for the next WHO classification.